Designing a curriculum evaluation plan. My topic today is going to be latent diabetes, MSM 574 by Jacqueline Jones. Driving and restraining forces impacting curriculum development. The most crucial step is the formation of objectives. Some of the identifiers are through Tyler's theory is studies of the learner, studies of contemporary life outside of school, and suggestions for subject matter specialists. Proposed using two screens, phys- phys- philosophy and psychology of learning, to filter out unimportant and inconsistent objectives. And one of the things that Tyler really stressed was that as an instructor, you want to make sure you gear your material or your course toward how the students learn, and are they understanding what you're giving to them, and to do like evaluations to see if they learn what you expected them to learn. Ralph Tyler, he was born in 1902, passed away in 1994, curriculum theorist. Tyler's curriculum was developed in the 1940s and is considered the most and considered the scientific approach. Most important justification of curriculum development was to oversee that students receive integrated and relevant learning experiences that contribute toward their learning growth and development. Tyler he published a book called The Basic Principle of Curriculum and Instructions in 1949. And his theory, his curriculum development is one of the most popular ones as of today. Tyler's concept of behavior objectives, curriculum organization, and evaluations are intensely rooted in the standards and accountability movement of the present is used today. Tyler's justification model. His justification included four central questions. What education purpose should the school seek to obtain? And one of the objectives of the school or the class is what the student needs in order to be successful. Each subject has natural objectives that are indicated as a mastery. All objectives need to be consistent with philosophy of the school, and they're often neglected in curriculum development. What education experience can be provided that are likely to attain these purposes? Developing learning experiences that help students to achieve. Step one, the student should be able to write an essay in regards to what they had learned, their learning experience. And how can these educational experiences be effectively organized? In organizing experiences, the teacher should demonstrate first, or should the students learn by writing immediately? Either way could work, and preferred is determined by the philosophy of the teacher and the needs of the student. And at this point, the instructor needs to determine a logical order of experience for the students. And how can we determine whether these purposes are being obtained? And that could be done through like evaluation to see what the students have learned by writing their essays, or doing like some type of evaluation, evaluating the material and the instructor. Title of curriculum: Latent Diabetes Mellitus Type 2, Autoimmune Diabetes in Adults, called LADA. The type of diabetes that seems to be straddled between type 1 and type 2, also known as type 1.5. That's because the patient is not a type 1 diabetic, but they were type 2, but the symptoms they have is leaning more toward type 1. So that's why it's called 1.5. Mainly geared toward type 1. And at the end, after we do the testing and everything, then it will be considered a type 1. Usually involves older adults ages 30 to 50 years old. According to the Diabetes and Metabolism Journal, 2 to 12% of adults with diabetes have LADA. And now we're finding out here lately that it's not only up to age 50. We've had patients 70 and 80-year-olds. What are the symptoms of LADA? The symptoms of LADA are similar to type 1 and type 2. So type 1 and type 2 basically have the same similarities, but of course type 1 is the diabetic who does not produce, the pancreas does not produce any insulin at all. And diabetes, it produces some to very little insulin. And the symptoms include frequency and large amounts of urinating, very thirsty, always feeling tired. Getting thinner is because they could be losing unexpected weight, or they could be at their normal weight, just a normal regular sized patient, whereas type 2 diabetes is usually you're a little bit overweight or you're overweight. The symptoms usually come from much closer than the type 2. Over months or weeks it takes for type 1. Type 1.5 is a lot slower than type 1. So therefore, in the meantime, that patient is being diagnosed as a type 2 diabetic and will be a type 2 diabetic and will be treated as one until they show symptoms of their blood sugars are not within the normal range, even on medications. They could even be on insulin, but it's still not enough to balance out. The medications are enough to balance out the blood sugar levels. Symptoms are more obviously and often come on more frequently than expected from a type 2. Being overweight is a major risk for type 2 diabetics, but people with LADA tend to have just a healthy weight, so they could be at a normal weight. And that's why it's hard to detect. Diagnosing LADA. Difficult to diagnose because, like I said, it's between type 1 and type 2. It's not geared toward 1 or 2, so it's just mainly in the middle. And it's usually diagnosed by mistake as type 2. The antibodies in the blood that are found in the patients with type 1 would be the same type of antibodies that they would be tested for in a blood test. And that test is called glutamic acid decarboxylase. And it's called GAD, antibiotic test. Diagnosing patients with at ages 30 to 50. But like I said, sometimes it's 70 to 80. It all depends. We have to watch that patient very closely because even though we're treating them, we're having them to do meter downloads, bringing in their meters to be downloaded, and their numbers are still running high, but their weight and the amount of insulin or oral medications they're taking does not match what you're seeing in that patient. So that's a big giveaway. The treatment for LADA, you treat it, they start out treating it like type 2 because we don't know that it's really a type 1.5. Regular monitoring of the A1C, that's the blood test that we do every 90 days. Sometimes we do it every 6 weeks. It all depends on what we're looking for. And we will not know that that patient has type 1.5 until, like I said, there's other signs, or this patient is on a max amount of orals and taking a large amount of insulin, but they're not losing weight or they're not gaining weight. Oral medications, an example of that is metformin. We usually max them out at 2,500 milligrams. And we can also add glipizide is another one that we use frequently. We max them out at 40 milligrams per day. And sometimes we'll add a third agent, Actose, Trigenta, but it just all depends on the care managers following up with the patients and staying real close to see what's going on and why this patient isn't progressing like they should to get the A1C down. Some patients have, who I've diagnosed with LADA, is one man said he had been told when he first joined the military that he was type 1, but it was nothing ever done about it. So then all along, when he got out the military, he was still being treated as a type 2. And he was 73 years old at that time when I diagnosed him. Injections of insulin. Insulin is used frequently. It's used more frequently in LADA than in a type 2 diabetic because we still treating him like a type 2 after we get the blood test, but he's still more dependent on insulin, which is like a type 1. A proper diet, the weight control, and exercise would be another way of treating it. But if they don't need to really lose weight, that's the sign. That's the biggest sign of it all is how they're not gaining weight, they're not losing weight, the BMI might be 28 or less. And the actions we take for LADA, there's no definite treatment. So you would still treat them as a type 2 until you get that blood test. Once it's confirmed, then they will be considered a type 1 diabetic and they would be turned over to our endocrinology department, who will follow type 1s. Researchers are looking at LADA to see how common it is and how to treat it after they're diagnosed. Healthcare professionals aim of treatment is to keep insulin production for as long as possible. So that is meaning that if they get diagnosed with LADA before we put them on insulin, it would be great if we could catch it early enough to start them on the max amount of orals to prevent them from getting on insulin, because since insulin can be a long time treatment. Recommendations for insulin should start early. Research is looking at whether anything can be done to stop LADA progression at the point where the patient needs the insulin. So basically, they're trying to catch it at an early stage, but sometimes it's just very hard if the primary care doctor is not really aware of what to look for. Then sometimes they will max out the patients on medication, notice that they're still having to increase the insulin, that would cause them to refer them over to endo and see if endo could figure out what's going on. The follow-up care, you need to go see your doctor regularly, and usually that's about every 3 months. Self-monitoring of blood sugars. Self-monitoring of blood sugars, usually if they're on oral medications, we do it twice a day, before breakfast and before dinner. Sometimes we might even ask them to do it after the biggest meal of the day, 2 hours after the biggest meal of the day, to check their blood sugars, to try to get this pattern to see if at a certain time they're running higher, and then that way we'll be able to kind of zero in on the LADA also. There, there are better glucose meters out there that is less painful, and because patients, they stick their cells at the tip of their fingers, of course, where the nerves are. It's very painful. If they haven't been taught the proper way to check their blood sugars on the sides of their fingers will get sore and they will stop checking their blood sugars because it's so painful. But the newest thing out on the market, the Libra, which you see advertised on TV, we're not really giving it out at Kaiser yet. There's a program that they're doing. It's a pilot program, and that meter is not given out because if a patient doesn't have to check their blood sugars 4 times a day, like a type 1, or if they're on oral medications where they only take it twice a day, or if they're just checking randomly after they have a big meal, Kaiser would not put them on the program, and that program is only done through our endocrinology department. And there are so many types of meters that's available. So a lot of them, everybody's looking to the painless one. And because of the price of the Libra, it's not the machine itself. The machine itself costs like $120 to $150, but it's the pods. The pods are the little pads that you put on your arm with the sensor on it. They cost $60 for every 2 weeks. So that would be approximately $120 a month. And so they're not covered by Kaiser. So patients will have to pay out of the pocket. So therefore, we do not recommend them or either recommend the primary care to give them out because they're just they're too expensive right now. But soon they should be out. And the convenience of a remote meter download is we have a meter that's called the VeroFlex Reveal that we are able to enroll patients in this program, which is a remote wireless program where the patient will pick up, I will order the glucose meter, patient will pick it up, they will call me once they get it, I will enroll them into the program, and when I enroll them, I will be sending an email telling them how to upload the app into their phone. They have to have an iPhone or an Android, and they will upload it in there. And when they upload it into their system, they're able to put their meter and their phone side by side, no more than 3 inches apart, and and um, and sync their blood sugars into their phone, which will come directly to me. And we usually set that up for me to receive blood sugars from patients that's on the remote meter download every 2 weeks. And the symptoms of the complications of LADA would be the same as with a regular diabetic, the type 1 or type 2. And that's your neuropathy, the nerves damaging your fingers, your feet, and also our retinopathy, and that's in the eyes, kidney failure, heart disease, stroke, blindness, and amputations. The last two, we're trying as hard as we can to prevent the blindness and the amputations, but for Kaiser here in San Diego, I think we're number one for amputations because patients could be so non-compliant till we reach out to them by phone. You know, we email them. We do everything we can to bring them into the doctor's office, but there's only so much we can do. We do have a pilot program that's being ran right now by Dr. Martin, and it's called the Diabetes Center of Excellence, where the managers select certain patients to go and see Dr. Martin or whatever doctors in their building that's seeing diabetic patients. And what they do is they have a confrontation with the patient. They have a consult with the patient. They He goes over their medications, do readjustments. If I have patients who have been on oral medications for a while and they do not want to do insulin, doctor can't talk them into insulin. I can't talk them into insulin. Then I'll send them to that class if they're willing to go, that program. It's just a one-time doctor's visit. And after they leave seeing Dr. Martin in Bostonia, then they'll go downstairs and meet one-on-one with a dietitian, because with diabetes, if we could help them to get their diets under control, we could basically control the diabetes and also the medication with that too. Program's outcome and the program credit hours to provide and update relevant educational information on LADA Latin, latent diabetes for professional nurses who has been working in a hospital setting for the last 5 years. We offer CEU hours according to the BRN recommendation of 50 minutes per one CEU unit, and this class would total 2 CEUs for this presentation, which will equal 2 hours. Participants need to be present for the entire presentation, including taking a pre and a post exam. And if there's any questions, and my references. Thank you.